Dating an ICU doctor. Back in the days, I was in a relationship with a woman who worked as a medical doctor at an intensive care slash stroke unit. I will tell you now how this relationship turned out to be and what the challenges are to be in a relationship with a woman with such a mentally and physically exhausting job. So, for those of you who have never been to an intensive care unit, it looks like this. It's a large room, and in the room are about 10 to 20, maybe 30 beds. The patients in these beds are almost dead. Their bodies are plugged into machines that take over all the work the body cannot do by itself. Pumps make the lungs breathe, pacemakers make the heart beat, tubes feed the stomach, add blood, water, salt, and other stuff. Electronic devices constantly supervising the patient's heartbeat, blood pressure, and brain activity. When you walk by the beds, what you see is hard to digest, and you never know what comes next. There might be a limb missing or half a head gone. I have seen such things. When you see such patients, it's not like in the movies. It is real and it is shocking, at least for someone who doesn't work there and is not used seeing such things. People working there are constantly saving lives. Not all lives can be saved, and this is why death is part of the everyday professional life of people working in intensive care units. But it's not only the patients you have to deal with working there, patients have relatives, and these families are coming to visit their son who had just had a motorbike accident and now misses a leg, or the grandmother who just had her third stroke and it's not sure if she will ever come back again, the uncle who just had a heart attack, the mom who just gave birth and almost bled to death, and so on and so on. Basically, people visiting a stroke unit are in shock and deep pain. Some of them are even in panic. Some of them just cry and won't stop crying. The worst thing that can happen is when a patient suddenly passes right in front of the eyes of the relatives. Now imagine you work there as a doctor. It is part of the doctor's job to talk to these relatives and tell them what happened and what they want to know. Doctors need to explain the condition of the patients and the chances of survival and recovery. In many cases, what these doctors need to tell these people is not good news. So maybe that's why doctors keep the talk relatively short and mostly hide some information or only give vague answers. And it's mostly impossible to tell if a patient will survive and to what point the body and the brain may be able to recover or not. Fact is, most people that are in an ICU unit will not fully recover, and the lives of these families will never be the same. I know what I'm talking about since my father is a stroke patient and is half disabled. It is a hard job for a doctor to work in such a place on a psychological level as well as on a physical level. You are under constant stress. So now, when you date a person who does such a job, be prepared. So now, before I continue talking, do me a favor, hit the thumbs up button, and you may even subscribe to the channel. Okay, so I'm sure that some doctors can handle the stress, grief, and mourning they witness every day better than others. But no doctor can do such a job and then forget about the workday right after when it's over, when she or he is coming home and just have a nice evening with their partners. It's not possible. When my ex doctor girlfriend came to my place after work, she always said, hi, gave me a quick hug, and then she would say, first, I need a beer and a cigarette, and then I'll tell you about my day. And At that moment, I already could tell if she had a bad day or not. So she would sit down at a chair in my kitchen and say nothing for a couple of seconds while I started cooking. I was always cooking while I was listening to my girlfriends. It is the only way they can have my uninterrupted attention for more than a few minutes. It's the only way for me to do real deep talk that does not feel like therapy or pillow talk. A living room is not a good place for deep conversation, and neither is the bedroom. It's the kitchen where deep talk is happening, at least for me. So I would turn some music on, so there's something else I can listen to when the words become too much. Music can also make me feel happy while talking about something sad. After some sips of beer, she started talking, and I listened. I was basically the trash bin for all the stress, frustration, and grief she had collected over the day. After she was finished talking about her work, she felt better. She started smiling and would ask how my day was. Guess how I felt? Me, the living trash bin for all that negative energy. Of course, I felt terrible. She just threw the mental ballast of her whole day on my head in a few minutes. Ouch. Now she was in good mood, but I wasn't. I had another 20 minutes of cooking to tell her what my sorrows were. But as soon as it started talking about what I'm struggling with, she would say something like, "You should think a little bit more optimistically," or "You shouldn't complain so much, you don't have any real problems," or "All you do is suthering." See, the balance in the whole thing was missing because sorrows are always relative. I listened to her, but she didn't want to listen to me. She had enough sorrows. Why would she listen to mine? After all, I am the man. A real man should be able to take it. He should be there for his girlfriend and listen to all her thoughts and sorrows every time she comes home from work, every day. So, if you consider a serious relationship with an ICU doctor, make sure to be a real man, not like me, because obviously I was not. Defining a real man for an ICU doctor woman: a man without empathy or emotions or the power of listening to bloody, horrible, sad stories while passionately preparing dinner. Bon appetit.